Hey guys, today I just want to give a little update on the COVID situation in Arizona. So a lot of patients are getting sort of getting angry, and they're not able to get their procedures and everything. And also the people out there that don't really want to wear masks. It's kind of crazy because they don't go in the front line and see what's happening to people. And COVID's different in every different patient, how they react to the virus. There's people that I know that, like, maybe they couldn't smell for a couple days and got better. Some people had to get home oxygen, even young patients. And then there's some that get blood clots, pneumonia, can't breathe, they get intubated, and they're in the ICU and the hospitals for anywhere between one to 3 weeks or even more. So what that does is it takes up the beds in the ICUs, and then once the ICU's filled up, we gotta put the patients elsewhere. So which usually ends up being our ICU nurses. The only people that can do ICU care from there is the recovery room nurses from the operating rooms. So those recovery room nurses are ICU nurses, so they take up the recovery room beds. What that does in the ends of surgery is you can't operate if the patients can't come out of the operating room. Then they'd have to stay in the rooms for 1 to 2 hours or even longer until it gets freed up so they can go to the recovery area. I just want to thank all the pulmonologists and ICU, critical care, cardiologists, internists that take care of these ICU patients. We're all putting in extra hours. For me, I'm putting in extra hours looking over cases, only allowing cases that definitely need to go. And we have multiple meetings throughout the day, updating, making sure the hospital's doing all right, seeing who needs help, and trying to figure these things out. So we're all doing our part. It's only a small part to just wear a mask and take control of the situation. And we've seen a steady decline since everyone wears masks. And you know, I'm ready. I was ready the last time we went back into it. I always wear a mask. I worked extra hours. I was pretty much operating 7 a.m. to 9 p.m. every day for almost 2 months when everything was open. A lot of it was trauma, but we were also doing breast reconstructions and all sorts of things. So we want to help you out. We want to get your surgeries done, but we just got to look at the greater good as well. So